These are some very exciting legal updates. I had some emergency rules on June 28th that were to implement the provisions of House Bill 2272. More emergency rules that went into effect yesterday, pursuant to House Bill 2646. The highlights of that, these are just kind of the big ticket items, but the first and foremost is cease and desist authority. We've not had this authority in the past, so this is exclusively reserved for emergency situations that pose a threat to public health. If we find out that that a bad actor is doing some truly bad stuff that could damage the health of patients, we can immediately cease their operations and then provide them a hearing within 10 days to figure out how best to proceed from there. And that's something we've not been able to do in the past. The point about stricter regulation on bad actors, prior to yesterday, if somebody was committing various and sundry violations of the law and the rules and we revoked their license, there was nothing to prevent them from immediately reapplying. And if they met the requirements under statute, the statute says we shall grant them a license. So we had no authority to not immediately re-grant a license to somebody who was really operating against the law. But now, if we revoke their license pursuant to a list of nasty violations, then they cannot get a license for 5 years after that point, which will be very helpful in weeding out a lot of these bad actors. It's also removed the 24-hour notice requirement for inspections. We don't have to tell somebody the day before we actually come out there. As a matter of practice, we're probably going to keep that notice in place for a few months at least until the industry is able to adjust. And quite frankly, we want to keep the safety of our compliance inspectors first and foremost. So until we get a better handle on the illegal market, we think it's probably wise to not go busting down too many doors currently.